I mean, a difference I feel like I've come to understand when it comes to healthcare, and I remember talking about this with our conversation with Kelly Gores, is like there's a fundamental difference that lies with acute care and chronic, right? Like we've made great advancements to heal or have an acute cure for a broken bone,
for sure,
or some kind of issue that is a major incident of some sort, right? Or a
this
quick
is not
illness
what we're talking about,
right? The difference really lies in the concept of these chronic illnesses where you're diagnosed with some sort of, perpetual disease that enlists you into taking a pharmaceutical drug in this perpetuity, right? Which, like, fundamentally, think about it, name me a better business model in history than you need to take this every day forever. Like, it's an unbelievable business model. And so, again, I think what I'd be curious to ask you about is for someone listening, and I'm even asking this in my own life, my instinct towards whether it's a proactive health plan or a reactive to something that was going on with my body would be to first go to my doctor, right? Which would be traditionally in a hospital setting. If I wanted to look beyond that, right, and I wanted to start to look towards what I could be doing with just the choices I was making, where do you start? Like, how can you start to look beyond the system that we're all known and used to here in the States?
Yeah, that's a good question. I think it's just breaking it down into questioning what is best for human beings in a physical standpoint. And I don't know if there's someone who truly thinks about it and is like, I really think protein bars and candy and chips and sodas that are completely manufactured are going to be good for me. Even though, like, even the things that are marketed as, oh, this is good, or it's high protein or whatever, like, if you really think about it and you really question someone who, say, isn't educated on the matter, or someone who is trying to be educated on it, like, they're not going to sit there and tell you, yeah, this is what we really should be eating.
Right.
The places that I started looking were just nutritionists, I would say.
Yeah.
And a lot of them that I've found have so many different views. And it's really hard these days because if you type in, like, what's a healthy diet into Google, like, so many things come up.
There's probably no propaganda in that first few results, frankly.
Yes, a lot. And ads,
Yeah.
right? And there's definitely so many routes to go. And it's one of the hardest things that my wife, Chelsea, and I talk about a lot. It's like, where do you find information these days? And where do you find trusted information? And I think ultimately it's within experimentation with yourself and dedication of, okay, I'm gonna not eat this for a couple weeks and see how it feels, because you can read all the books and research papers, but ultimately you need to feel it for yourself. And when my trainer, Don Saladino, told me to stop eating dairy and gluten, I was like, why? Like, how is that possible? Like, what do you mean don't eat dairy? What do you mean don't put cheese on my Jersey Mike sandwich, or don't put cheese on my burger, or don't eat, like, milk with my cereal? Like, that was unfathomable to me, because it was the natural way, the American diet. And once I went about 2 months without eating dairy, I was sleeping better. I was having more mental clarity. I felt like I could recover quicker. It was just wild to me that something that simple, but seemed hard at the time, could make such an impact on my life. And now I've realized that, like, my viewpoint has changed on dairy, because the dairy that I'm talking about, and the dairy that I think is very important to get rid of, is the highly processed, antibiotic fed cows, like, preservative added dairy that you see on the shelves that are just mass produced, But I think raw cow milk is beneficial if the cow is raised properly, and not fed with hormones and antibiotics and are giving shots all the time. And if they're truly, truly free range, not like free range, which you see in an advertisement, and grass fed, like you see in an advertisement, which everything can be gotten around these days because there's a way to profit from it. So like if you see free range advertised, it means they could be outside for like 2 hours a day. And the rest of the time they're inside, like shackled and just getting milked and like pumped with antibiotics. And it's just really crazy to understand when you see what truly is happening with our food industry in the United States.
Yeah.
And like even look at like Kellogg cereal in United States ingredients versus like Europe or Italy. Right. There's a fifth of the ingredients.
Yeah. No, the stat I heard the other day is mind blowing.
It's
and
insane.
I remembered it because I was so taken by it. But it was Casey and Calamines that were talking about it, and they said in 1951 there were 700 ingredients that were FDA approved in the United States. FDA and EPA approved in the United States, and equally in Europe by a different governmental agency, right, that oversaw Europe. Today, there's over 10,000 approved in the United States, and there's still just 700 approved in Europe. And it's like you think about that conceptually, and it's like we all have that when you travel to Italy, right? We go over there and we eat all the pasta and we eat the pizzas, and it's like, what the heck? Like, why do I not feel so heavy? And you're like, well, maybe it's because I'm walking around more. You like theorize all these things. And it's like, actually, maybe it's because the pasta and the pizza you were eating was from a pure wheat or a pure ingredient source that's a single source ingredient versus something that has all of these different 25 letter chemicals in it. And it's
grown by local farmers.
Right.
Like,
and the concept of like, somewhere in the last, 50 to 70 years, we replaced the chefs in the kitchen with the scientists and took all, if you go back to again, incentive structure, who owns so many of these mass food companies, like several of them are owned by the original tobacco companies that invented the cigarette forms that had these incredible addictive qualities to them that they've then replaced and put into foods. And those foods now have the same addictive qualities, right, in our chips that we eat and our cereals that we eat. And the worst part is it's getting into children, right? We're going to our schools and we're giving Fruit Loops and nonsense to our kids that start them off on this terrible trajectory, and it's systemic. And that's why, I said at the beginning, it's like the American people are set up for systemic failure, whether they believe it or not. And you have to actively work against the system to look out for your own health. And I think what we're seeing now is this great awakening. And part of it comes, form and touch with the conversations we're having here, and that you can have direct to source. You and I are having a conversation based in our own opinion. We're not bought by anybody. We don't have to sell any of our opinions to some advertiser base like the news does to these companies, right, that incentivize them. And, again, you look at, another thing, it's like, I know I'm all over the place, but I'm passionate about like medical schools. I mean, the vast majority of funding that comes behind medical schools is actually funded by pharmaceutical companies.
Exactly.
Again, the root lies in the incentive structure, and it's completely fucked up.
Well,
but how do we get into that? And it's through education. To me, it's like we have to talk about these things, and we hear it more than ever. I mean, people are curious. People are dying. Chronic illness is at all-time highs. Depression is at all-time highs. We have more antidepressants subscribed than ever before to people, and yet our depression rates are the highest they've ever been. And science tells you that exercise has a better chance of making you happier, getting less depressed than taking an SSRI.
For sure.
Yet we're more prescribed than ever.
Yeah.
So, it just, I think my answer to the question I originally asked to you is like, it starts with a common sense response in yourself. It's like looking past the veil of trusting that this society is looking out for you, looking past the veil that our healthcare system is necessarily has your best interest at stake. But that's a scary road to start to walk down for a lot of folks. And it's scary to start to see the issues that lie. And I'm afraid that there's going to be a lot that's going to get uncovered. But through that education and through talking about it, I'm very hopeful that we can build to a better future. And, you know, I'm totally hopeful in humanity. But I really believe that having conversations like this is a huge part of it.